It's tax season, and at LifeLock, we know you're tired of numbers. But here's a big one you need to hear. Billions. That's the amount of money in refunds the IRS has flagged for possible identity fraud. Now here's another big number. 100 million. That's how many data points LifeLock monitors every second. If your identity is stolen, we'll fix it guaranteed. One last big number. Save up to 40% your first year. Visit lifelock.com/podcast for the threats you can't control. Terms apply.
Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 questions podcast combined and ad-free. You'll also get early access to all of our Step 2 questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com. Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, saving the bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai and her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now and tune in for a variety of great guests and topics. Hey everyone, Chris here from MedPrep2Go, and welcome back to another episode of our USMLE Step 1 Questions podcast. In today's episode, I'll be reading for you 3 microbiology questions from our online qbank, and as always, a friendly reminder that you can read these questions and more at medprep2go.com. And with that being said, let's get started with question 1, Microbiology 31. A 72-year-old man is brought to the emergency department by his wife due to fever, headache, confusion, and difficulty walking for the past day. He has a history of type 2 diabetes mellitus and alcoholic cirrhosis. His HbA1c was 8.6% 2 months ago. He has not traveled recently and has no known sick contacts. His wife reports that he eats soft cheeses and cold deli meats regularly, including a recent batch of imported brie. He is up to date on vaccinations, including pneumococcal and influenza vaccines. Temperature is 38.8 degrees Celsius, or 101.8 degrees Fahrenheit. Blood pressure is 132/84 millimeters of mercury. Pulse is 92 beats per minute, and respirations are 18 per minute. Physical examination reveals mild confusion, knuckle rigidity, and an ataxic gait. Kernig and Bredzinsky signs are positive. A lumbar puncture is performed and cerebrospinal fluid shows elevated opening pressure, 400 white blood cells per cubic millimeter, 75% mononuclear, low glucose, and elevated protein. Gram stain of the CSF reveals small gram-positive rods. Which of the following organisms is the most likely cause of this patient's condition? A. Cryptococcus neoformans. B. Haemophilus influenza type B. C. Listeria monocytogenes. D. Neisseria meningitidis. Or E. Streptococcus pneumoniae. And the correct answer is C. Listeria monocytogenes. Listeria monocytogenes is a facultative intracellular motile gram-positive rod that can cause meningitis in elderly, immunocompromised individuals and neonates. It is transmitted primarily through contaminated food, particularly unpasteurized dairy products, deli meats, and soft cheeses. Listeria is able to survive and multiply at refrigeration temperatures, which contributes to its association with refrigerated foods. In adults, listeriosis can present as meningoencephalitis, particularly in patients with risk factors such as older age, diabetes, alcohol use disorder, and immunosuppression. This patient's cerebrospinal fluid findings, mononuclear pleocytosis, low glucose, high protein, and gram-positive rods, are characteristic of Listeria central nervous system infection. Answer choice A, Cryptococcus neoformans, is incorrect. Cryptococcus is an encapsulated yeast that causes meningitis primarily in severely immunocompromised patients. For example, AIDS with CD4 less than 100 cells per cubic millimeter. CSF typically shows lymphocytic predominance, low glucose, and elevated protein, but India ink staining or cryptococcal antigen detection, not gram stain, are diagnostic. This patient's gram stain shows gram-positive rods, not yeast. Answer choice B, Haemophilus influenza type B, is incorrect. H. influenza type B is a gram-negative coccobacillus that used to be a common cause of pediatric meningitis but is now rare due to vaccination. It primarily affects unvaccinated children. This patient is an elderly adult with recent exposure to high-risk foods and has evidence of an organism that stains as gram-positive rods, not a gram-negative coccobacillus. Answer choice D, Neisseria meningitidis, is incorrect. Neisseria meningitidis is a gram-negative diplococcus and a leading cause of bacterial meningitis in adolescents and young adults. It often presents with petechial rash and rapid progression. This patient's age, CSF findings, and gram stain do not support this diagnosis. N. meningitidis would appear as gram-negative diplococci on gram stain. Answer choice E, Streptococcus pneumoniae, is incorrect. S. pneumoniae is the most common cause of community-acquired bacterial meningitis in adults, and it appears as gram-positive lancet-shaped diplococci. This patient's gram-positive rods, along with dietary risk factors and immune status, point toward Listeria rather than pneumococcus. Key learning point. Listeria monocytogenes is a gram-positive rod that causes meningitis in elderly and immunocompromised patients. It is transmitted through contaminated foods such as unpasteurized dairy and deli products. It should be suspected in patients with meningioencephalitis and gram-positive rods in CSF, particularly with compatible risk factors and exposures. Now for question 2, Microbiology 32. A 45-year-old man presents to the emergency department with a 1-week history of fever, chills, and chest pain. He has a history of intravenous drug use and no other past medical history. He reports a new heart murmur heard during a recent clinic visit. Vital signs show temperature of 39.2 degrees Celsius or 102.6 degrees Fahrenheit, a heart rate of 97 beats per minute, respirations of 18 per minute, and blood pressure of 135/76 millimeters of mercury. On physical examination, a grade 3/6 systolic murmur at the right sternal border is heard on cardiac auscultation. There are dark lines on his fingernails. Echocardiography shows valvular vegetations. Blood cultures grow catalase positive and coagulase positive gram-positive cocci in clusters. Which of the following is the most likely causative organism? Answer choice A, Candida albicans. B, Enterococcus faecalis. C, Staphylococcus aureus. D, Staphylococcus epidermidis. Or E, Streptococcus viridans. And the correct answer is C, Staphylococcus aureus. This patient presents with fever, a new murmur, and positive blood cultures showing gram-positive cocci in clusters, which are catalase positive and coagulase positive, which is a clinical picture consistent with Staphylococcus aureus endocarditis. This is the most common cause of acute endocarditis in intravenous drug users, often affecting the tricuspid valve. Answer choice A, Candida albicans, is incorrect. Candida albicans causes fungal endocarditis with large vegetations, typically in immunocompromised patients, and grows as yeast. Answer choice B, Enterococcus faecalis, is incorrect. Enterococcus faecalis causes endocarditis in older patients or post-procedures, is a gram-positive cocci in chains, and is catalase negative, not coagulase positive. And answer choice E, Streptococcus viridans, is incorrect. Streptococcus viridans causes subacute endocarditis in patients with pre-existing valve damage, is alpha hemolytic, and grows in chains, not clusters. It is coagulase negative. Key learning point. Staphylococcus aureus is the leading cause of acute endocarditis in IV drug users. It is identified as gram-positive cocci in clusters, is catalase positive and coagulase positive, and often affects the tricuspid valve. Hey everyone, Chris here from MedPrep to Go, and I wanted to let you know about our premium Step 1 Bundle podcast, which gets you all of Crush Step 1 and our Step 1 Question podcast combined and ad-free. You'll also get early access to new content as it becomes available. Upgrade your studying now and learn more at medprep2go.com. Hey everyone, Chris here from MedPrep to Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. And moving on to question 3, Microbiology 33. A 34-year-old woman presents to the outpatient clinic with a 4-day history of watery diarrhea, abdominal cramping, and low-grade fever. She recently attended a picnic where she consumed undercooked chicken. She denies bloody stools or recent antibiotic use. Vital signs are blood pressure of 106 over 64 millimeters of mercury, heart rate of 120 beats per minute, and temperature of 37.8 degrees Celsius, or 100.04 degrees Fahrenheit. Physical examination reveals tachycardia and generalized right lower quadrant abdominal tenderness to palpation. Laboratory studies include a serum creatinine of 1.1 milligrams per deciliter, blood urea nitrogen of 37 milligrams per deciliter, alanine aminotransferase of 38 international units per liter, and aspartate aminotransferase of 25 international units per liter. Stool culture grows gram-negative, comma-shaped bacilli that are oxidase positive and grow on thiosulfate, citrate, bile salts, sucrose agar with yellow colonies. Which of the following is the most likely causative organism? Is it A, Campylobacter jejuni, B, Clostridium difficile, C, Salmonella enterica, D, Shigella flexneri, or E, Vibrio cholera? And the correct answer is A, Campylobacter jejuni. Campylobacter jejuni causes foodborne gastroenteritis with watery diarrhea and abdominal cramping and is often linked to poultry. Stool culture shows gram-negative, comma-shaped, oxidase-positive bacilli forming yellow colonies on thiosulfate, citrate, bile salts, sucrose agar. Answer choice B, Clostridium difficile, is incorrect. Clostridium difficile typically causes diarrhea following antibiotic use, is gram-positive, and forms toxin-mediated pseudomembranous colitis. Answer choice C, Salmonella enterica, is incorrect. Salmonella is a gram-negative, non-lactose fermenting bacillus, is not comma-shaped, and grows on selective media like Hectone enteric agar. Answer choice D, Shigella flexneri, is incorrect. Shigella causes bloody diarrhea, is a gram-negative, non-motile bacillus, and does not grow on thiosulfate, citrate, bile salts, sucrose agar, or show oxidase positivity. Answer choice E, Vibrio cholera, is incorrect. Vibrio cholera causes profuse rice water diarrhea and grows on thiosulfate, citrate, bile salts, sucrose agar with yellow colonies, but is associated with contaminated water, not poultry, and is less likely in this clinical setting. Key learning point. Campylobacter jejuni causes foodborne diarrhea, is poultry-linked, identified by gram-negative, comma-shaped, oxidase-positive bacilli with yellow thiosulfate, citrate, bile salts, sucrose colonies. Self-limiting, azithromycin for severe cases prevents complications like Guillain-Barré syndrome. And that will conclude this episode of our USMLE Step 1 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read other great USMLE Step 1 questions at medprep2go.com. Happy studying!